Everything you need to know about hernia. What is hernia? Hernia happens when something inside your body pushes through a weak spot in the muscle or tissue that's supposed to hold it in place. It can cause a lump or bulge that you can see or feel, and sometimes it can hurt. Types of hernias. Inguinal hernia, common in the groin area. Femoral hernia, lower down in the groin area, more common in women. Umbilical hernia, near the belly button. Hiatal hernia, stomach protrudes through the diaphragm. Incisional hernia, develops at the site of a previous surgical incision. Causes and risk factors. Weakness or tear in the abdominal wall. Chronic coughing or sneezing. Heavy lifting or straining. Obesity or excess weight. Pregnancy or childbirth. Previous abdominal surgery. Symptoms. Noticeable bulge or lump. Pain or discomfort, especially when lifting or straining. Feeling of heaviness or pressure in the abdomen. Burning or aching sensation at the site of the hernia. Diagnosis. Physical examination by a healthcare professional. Additional tests such as ultrasound or MRI may be recommended for confirmation. Treatment options. Lifestyle modifications. Avoid heavy lifting or straining. Medical interventions. Surgical repair may be necessary to strengthen the abdominal wall. Surgical procedure. Hernia repair surgery involves pushing the protruding tissue back into place and reinforcing the abdominal wall with stitches or a mesh patch. Conclusion. Hernias are treatable with prompt medical attention. Understanding the causes, symptoms, and treatment options is crucial for proactive management. Consult a healthcare professional if you suspect you have a hernia or experience any related symptoms.